Hello, everyone. What an exciting discussion we have today. This is our first ever online panel event, so thank you for joining us. Who is with us today? Well, let me take a deep breath because we have the incredible Iqra and Gregory from the Osteopathic Centre with us today, but they are not alone. Let me tell you a funny story, one that I hope won't offend Iqra and Gregory. Whenever we try to arrange a masterclass about osteopathy, we don't get as many signups as we know we should get. We want to help more and more people understand the sheer scale of the symptoms and problems that osteopathy can help with. But I guess it doesn't always translate to, oh, I must watch that movie type of episode. So I had an idea, or we had an idea. It's professionals like doulas, childbirth educators, dietitians, mental health and sleep experts that often see the first signs and symptoms that they know osteopathy can help with. So we thought it would be really helpful for all of you at home to hear it from both perspectives. What symptoms do the village professionals spot that ultimately leads us to recommend a visit to the osteopath? So you will hear from all of us on the panel today, discussing how we work together as your village and ultimately how osteopathy is a key component in the care of our pre- and postnatal clients. The legal stuff. The educational content of our masterclasses is the work of our pregnant and POPT partners. We are not licensed medical or legal professionals, and this is neither a medical nor legal platform. The content of today should not be considered medical or legal advice. Instead, it is always best to consult with your specialist providers for any specific concerns or questions, and use the information from today as a complementary tool to help you guide those discussions and care plans with your providers. In short, our goal is to provide a supportive and informative community for expecting and new parents, but it's important to always prioritize your own health and the advice of your specialist providers. So let's get into this. Hi, I am Kathy. I am your moderator for today. I am also a certified postpartum doula, a mother, and the founder of the Pregnant and POPT community. Also with me today is Annabelle. Annabelle is a dietitian specializing in women's health, diabetes, and general pediatrics. Louise is the longest serving sleep consultant in Singapore and Southeast Asia. Helen is a trained midwife, having overseen more than 1,000 births, and she is a birth doula here in Singapore. Maud is a childbirth preparation instructor, specializing in hypnobirthing. And Dr. Sylvia is a registered counselor and psychotherapist with specialized training in maternal mental health. And of course, our hosts today. Iqra is clinical lead and senior osteopath, and Gregory is the director and senior osteopath at the Osteopathic Centre. And together, we are your panel today. We are ready to go, guys. So maybe I should first throw a question out to Iqra and Gregory so that they can introduce themselves, but also answer maybe the biggest question that we often get, which is, what is osteopathy and how does it differ from other manual therapies like chiropractic and physiotherapy?
So thank you guys for being here all over the world as well. Me and Greg are super grateful. So yes, my name is Iqra. I've been with the Osteopathic Centre for nearly 6 years now. And you've asked a huge question. What is osteopathy? And the reason is it's just subjective, all-encompassing profession. And the reason that is because it's quite autonomous and it's the individual take of the osteo that makes it unique. So you will never really get two osteos who treat the same. Everyone brings their own je ne sais quoi, as my French colleague would like to say, into the treatment. So there are some bare bone, no pun intended, fundamentals though. There are some things that are quite grounded in osteopathy, and mainly where primary healthcare, manual, complementary therapy. So it's pretty hands-on, the type of therapy, and it is trying to look at how different body systems interact into the musculoskeletal system. And it's very holistic in nature. So we try to not only find the root cause of your pain, but also treat that and not just the symptoms. Osteopathy in general is one of many complementary therapies out there. And the holistic nature and the structure governing function element to osteopathy is what makes us unique. So, for example, if you're coming in with foot pain, we're not going to purely just look at your foot. If it's foot pain, we want to look, is it coming from a local source? Is it a bunion or a plantar fasciitis? Or is it coming from something like your ankle? Are you a runner and you've increased your running and your heel striking more now and it's referring into foot pain? Or is it coming from knee? Like, are you pregnant? Do you have a previous ACL injury? Are you weight bearing more on the front of your front foot now? Or is it coming from your lower back? So once we identify the root cause of a patient's issue, we try to treat that way. And we use an array of treatment methods. Greg treats pediatric all the way to geriatric. So we're going from foot pain to headaches to TMJ issues. So yeah, it's a very hard question, but I hope you got a little bit of an idea about it.
Add something, yeah. Hi.
Please
So
do.
Yeah, I'm going to introduce myself as well. So thank you, Ikra, for introducing first. But I'm Gregory, French osteopath, and I've been in Singapore for now 7-8 years. Same, working with the Osteopathic Center all the way. I think the description that Ikra used was very accurate, and it's hard to pinpoint specific issue, specific symptom we work with because we kind of like cover everything that is musculoskeletal. So if it is something we can work on with our hands, we would do it. There's often this question that comes up a lot, which is what is the difference between osteopathy, physiotherapy, and chiropractic? The most simple way I like to explain and describe is usually we find ourselves kind of in the middle. So we got the physios, the chiros, and osteopathy is a bit of a mix of everything. We use a range of techniques that are close to the physio ones, close to the chiropractic ones when it comes to adjustment, a bit more rehabilitation ones when it comes to like physiotherapy type of techniques. And the mix of everything is what we do. So that's, I think, a good description of what we do.
Yeah, I think that's really helpful for people listening to understand that you sit in the middle, kind of melting those practices together and drawing upon different techniques as and when you need to. But let me just clarify for everyone at home, so and double check that we're all in the right place, because today we are going to be mostly shedding light on prenatal and labor support and how osteopathy helps with that. I know Helen and Maud, coming from the doula and hypnobirthing background, very much in that prenatal labor support world, and I know that they've got some really interesting things to talk to you about on that. And then the postnatal care and the baby's health. I know, Greg, you see a lot of newborn babies and babies as, you know, they're growing up through the child development stages. So really excited to hear more about that and interesting stuff and how it connects with maybe sleep challenges and feeding challenges in that developmental milestone kind of period in their life, and then emotional well-being. And I really do want to make sure that we get onto this. And we've got the reducing the stress factor in pregnancy, leading up to the birth, but then also promoting mental health and relieving tension and, you know, mental and physical tension through the postpartum period. So I'm really, really excited to get onto that stuff at the end as well, especially with Dr. Sylvia being on this panel with us today. So I am going to first lead off. Let's, you know, start at the start of this journey. When is it safe in pregnancy? And actually, maybe let's bring Helen into this. Helen and Greg and Ikra, at what stage do you guys start talking to each other about how osteopathy can help?
So it's safe throughout all of pregnancy. And it can be really helpful alongside midwives and doulas and lactation consultants postnatally as well. We are cautious before the 12-week mark especially in the sacral and lower back region. We won't really manipulate very harshly in those areas. However, if a patient is coming in for unrelated to those areas like knee pain or foot pain, yes, we will treat. I would definitely say that after the 12-week mark is when we see more pregnant patients come in. But yeah, it's pretty safe throughout the whole journey.
Okay,
Yeah,
and Helen,
you know how much I value you guys and your treatment of certainly my clients. We just want pregnant women to benefit as much as possible from as many people as possible to make their journey as comfortable and as easy as possible. But how can we explain it to pregnant women? I mean, when they come to me, usually post 12 weeks, but sometimes I get them at 4 weeks.
Yeah.
I always explain about osteopathy, and sometimes I maybe not explain it too well. So how can we get the message across?
So I would say the three best ways to think about it is help you to prepare for birth. I would say that's the first thing. Okay, so whether you have pain or not, reducing existing discomforts that you feel, or helping with pregnancy-related conditions that arise during the journey, and definitely for just general well-being and stress levels. So I've had patients come in, probably some of Helen's as well, that you're like, oh, I have no pain, but I want a natural birth and as pain-free as possible. So we try to work miracles in those cases. But a lot of patients will come and say, I struggle with my hip rotation. I can't open up my legs for long periods of time. I've had a previous injury. I've had a skiing accident. Is there any way you can help? So we're just doing basic hip rotations and articulations and giving strengthening during those areas. I've had patients come in saying, I'm at work all day and my posture is like shot every time I'm working past a certain point. So we're again doing posture advice. With a typical pregnancy posture is like, well, we all know it. It's like a head tilt. There's a lot of a curvature in the lower back. There's a big curvature in the neck. There's usually a bit of a one shoulder higher than the other situation. Legs can be out. You can have a bit of swelling, a bit of edema. So in terms of pregnancy-related posture, we try to advise and work on it further. Then we have those pregnancy conditions. So you've got your pubic symphysis dysfunction, which can affect 1/5 of pregnancies. And we do some direct techniques in the pubic and indirect techniques as well. You've got pregnancy rib, where patients are coming in feeling very shallow of breath and feeling like baby is just poking me here. Like, how do I find relief in this area? So we do work within the mid back and the rib cage and the diaphragm. In terms of swelling, edema, the whole pregnancy swelling, we do a really fantastic, it's called lymphatic drainage technique. So it's a rhythmic, non-painful pumping technique to help reduce tension and swelling throughout the lymph nodes. So the lymph nodes basically we have them all throughout the body, and it's like it's a lymphatic drainage system for the body. With pregnancy, it can cause a lot of pooling in the area. There can be a lot of excess fluid. So we do this pumping technique that works from the foot to the groin, all the way from the hands to kind of the axilla, the armpit area, which can be really helpful for patients. But in terms of emotional support, this is, I think Greg can speak on it as well. We know the remits of our profession. We know that we're manual therapists. So we know that some pregnant patients are coming in with distress, anxiety, personal matters. So once we try to help pain levels, and we're trying to do techniques to reduce stress. And those techniques that reduce stress is your sympathetic nervous system, which is, again, your fight and flight. So if you're in a high stress situation, are you going to be Muhammad Ali or Usain Bolt? Are you going to fight or are you going to run away? So what we try to do is work on this chain that starts from your mid to low back. And we try to do techniques to alleviate that. We also have the parasympathetic nervous system, which is your rest and digest. So this chain just works on the whole body. And it starts from the brainstem into the neck, into the mid back, and it can lead to branches into the jaw. So the biggest issue for TMJ and jaw problems is stress. When you go to the doctor, the number one cause is stress. Because of that, we do a not so friendly technique in the jaw, but it's not so friendly at the time, and it can be really, really, really relieving afterwards. We literally put gloves on, try to release the jaw.
I've had it.
Yeah.
It works wonders.
It works
I've got a
wonders
lot. I've got a
after.
lot less headaches.
Yeah.
But yeah, it's worth it.
Exactly. But you kind of have to go through it and then you'll get the benefits from it afterwards. So yeah, working throughout this, but I mean, we know that we can only help to a certain degree. And that's when people like Dr. Sylvia is really important, because if somebody is dealing with anxiety and stress, and we know that this is something beyond a mechanical reason, we would 100% refer further.
I've also noticed that women that come to you, a lot of them, and it doesn't work for everybody, but most of them, their babies get into the optimal position for birthing. So I'm just wondering what you do. It's like magic.
Yeah, I just literally had a patient in the last 2 weeks, and she literally last Friday was saying to me, I have until last Friday. My doctor said, if my baby doesn't turn, I have to do a C-section. Can you help me? And I'm like, ethically, I cannot tell you that we help turn baby. Like, I need to put that out there, and I need to put that signboarded. Like, we do not by any means claim to turn baby or do any techniques to turn baby. We do things, however, in the spine and in the rib cage, where we create space and release fascial tension, so baby naturally turns. So there is no magic technique that we do, if that makes sense. But we're just trying to release tension, fascial release to help baby turn. And I think Greg would agree, he does the same.
Yeah, and I think it's important to, as you said, like to mention that as we do not just for postnatal or during pregnancy, we always try to put the body back on the right track. So it's more like helping the body, and this is the core of osteopathy, helping the body to heal itself. So we're just like a little trigger, and we're trying to help throughout the treatment to get on the right way. So not claiming to make like very big changes all the time, but helping for those changes to happen. I think that's alongside with what you just said. So yeah, just to confirm it.
Yeah, it's fascinating, really. So you're just providing that space for the body to do what it's meant to do, really,
Yeah.
and for baby to do what baby's meant to do. When you were talking about things like the jaw and the diaphragm, I couldn't help but thinking in terms of how that leads on to the relaxation techniques and the ability to stay in control. And I was thinking of you, Maud, and hypnobirthing techniques along this way, because obviously the importance of being able to breathe properly, open up your diaphragm must be so important, I think, in what you teach.
Yeah, I do teach breathing techniques. Yeah, and can you explain like maybe how osteopathy can help? Because I'm teaching belly breathing techniques, so using the diaphragm, and it's not always easy for mothers with this big belly and the baby inside to understand how to use their diaphragm. So maybe how osteo can help with the breathing techniques by improving rib cage and diaphragm mobility to help mothers breathe more easily and stay calm during labor?
Yeah, so basically, first of all, I have to say what Maud does and what any hypnobirthing specialist does is fantastic. And I really wished more pregnant patients did it. It's not very well known. I feel like the patients who have done it, the journey is completely different. So I think the confidence is different, the journey is different, the breathing patterns are different. I think it's quite powerful. So I would say the first thing to do is to even identify, for a lot of patients, they don't even know how to identify diaphragm. They don't even know what diaphragm is. They don't know that it's the most powerful respiratory muscle that we have. So creating that mind-body connection from diaphragm, like this is what we want to move. This is the space that we're trying to create, contract, and relax. That's the first thing, just identifying, causing a sense of understanding. We work directly on diaphragm, which can feel very pokey and not so comfortable. But again, it's trying to not only relax the diaphragm to get it to ease off if it's stayed in a contracted state, which does happen in stress and a lot. But not just the diaphragm. The diaphragm connects to a lot of different structures. You've got parts of your mid back, your low back. It connects to parts of your hip flexor. And your hip flexors go from your diaphragm all the way towards your groin. So if you can imagine when you're pregnant and the belly is distending, you're pulling onto that hip flexor for dear life. So basically, it's not as important just to work on diaphragm. You're working on all the connections around that area. We also do a lot of like rib work. So working within the pec and the bicep and the chest, because pregnant patients typically show a sign of being really protracted, and even postnatally, actually, when they're breastfeeding as well. So things that open up the rib cage, things that get the mid back moving better. And then we do give a bit of breathing exercises, but definitely not as well as you do, for sure. Definitely not as well as you guys do, because you're more specialists in that. But would give more basic breathing techniques to follow as well.
Yeah, I think like for those who can't really picture what a diaphragm is some kind of a big balloon that is just at the bottom of the chest and the ribs. And again, as you were saying before, we're trying to release it to create more space. And the breathing connection with the diaphragm is also very tight, but the space, the musculoskeletal view on it is also important. And if the diaphragm is released enough, there is more space and more space for the baby, obviously. So that, yeah.
You were mentioning also the hip flexors, so the PSOS muscles. So how can osteopathy help release? Because sometimes pregnant women, they feel a lot of tightness in this hip flexors muscles. So how do you help releasing them to make childbirth easier?
So we do a lot of things. We do stretching techniques. We do physical hands-on techniques that's quite deep again and very pokey in that area. We teach patient how to stretch and do it with breathing. So you're stretching and doing the stretch with the breathing element. And a lot of the times I'll get patients to place hand on chest, hand on stomach to make sure they're breathing diaphragmatically and whilst doing hip flexor stretches. So we do a bit of something called MET, which is a muscle energy technique that also gets the patient to engage the muscle, then relax, then engage, then relax. So again, it's all about triggering that nerve to get nerves kind of innervate muscle. So if you want that muscle to relax, you need to kind of get that nerve to calm its stimulus a little bit. And we do so by hands-on, indirect, and direct techniques onto the area.
And just closer to birth, also some mothers experience stress and anxiety, and obviously I can support them mentally with the hypnosis techniques. But so how can osteopathy provide also some relief with stress and anxiety when you're approaching childbirth?
Yeah, so it goes back to your sympathetic nervous system, trying to get that to calm down. The techniques we use, there's also techniques like craniosacral. Some of you may have heard of cranial osteopathy, and that's a lot of relaxation for your central nervous system. And if you kind of relax your central nervous system, you're trying to get the whole body system to relax. We're also trying to work on the parasympathetic nervous system, which is, there is a nerve called I always find it funny, it's the vagus nerve. It's there for relaxation, but you're in Vegas to party, so I always find that really funny. But apart from that, you're trying to get that to stimulate, and you're following that nerve where it comes out from. And anything that nerve innervates, we're trying to relax it. So it's never just, how do I say this? They're coming in with tension, we're just going to treat the head. No, we're trying to treat the whole nervous system. We're trying to treat the whole chain from kind of skull to sacrum area.
Wow, it's absolutely fascinating. I love hearing about how it's all connected. I'm going to move the conversation on a little bit. We will come back to mums and adults, but I also wanted to make sure that we touched on the support that you guys give for, because I know manual manipulation, as we may think of for osteopathy, it might seem intimidating to some parents, but I also know, Greg, that you see an awful lot, well, all of you do, you see an awful lot of babies that come through, especially for those developmental checks and those various milestones that we all want to see off along the way. So, Helen, you're often the first people there as well, because you do those first postpartum visits and checks. What is it that first triggers you to think baby might need to see someone like Greg or Ikra?
So often at a traumatic birth, babies can suffer a lot of trauma, particularly if mum's been in the second stage, the pushing stage, for a long time, or we know that their position hasn't quite been right and the baby's been birthed by forceps or ventouse. And often I see a little bit of irritability in the baby, lots of crying, lots of movements that I'm not quite sure about, or if they've had their shoulders stuck, shoulder dystocia, that would be another reason for me to do a straight referral to Greg, because Greg's the one who works with babies. And for me, if they've got any problems with feeding or gut problems, I would refer them to Greg. So what do you do, Greg?
So just to jump back to what Kathy said before, yeah, it's important for parents to understand that all the techniques are very, very gentle. We are sometimes pokey on adults, but we're not with babies, and they never feel any pain. That's important to say. When it comes to traumatic birth or tensions caused by in the womb position or sporty delivery, let's put it that way, as Ikra was saying before, the sympathetic system, so the nervous system, the fight or flight system, is quite triggered. And the first thing to do, from my point of view, is to release that stress by doing very gentle cranial work to just calm them down. Then, after a traumatic birth, like let's take the example of forceps use, the baby might develop a few tensions, and usually musculoskeletal tensions. So if you put a lot of pressure on some part of your skull, you're going to create a bit of tension. If the tension leads to a muscle tension and restriction, that's what we're going to work on. So, for example, babies that have been pushed or ventoused or the forceps has been used, they can develop some knots, I would say, in the muscles, for example, in the neck. And that's what I would work on, releasing that tension to allow the spine or the biomechanical system of the baby to move better. So that's what I do. When it comes to the technique, again, it's hands-on, very gentle, and trying to always go with the flow of the baby. So it's basically what we do with adults, but in a very more gentle way, I would say. Yeah, is that clear enough?
You're nicknamed the baby whisperer.
Yeah, well, I don't really like that nickname, but yeah. And I just speak to them very gently. That's why we call it whispering, I guess.
You've just given me a really nice link, Helen, because the next person I wanted to talk to was Louise, actually. So baby whispering and sleep kind of gave me a really nice gentle lead in there, because I was thinking about the kind of possibly the next concern that we all hear about in this world with babies. We get through the pregnancy, we get through the birth, we deal with any immediate needs of the baby. And notice order events here. We still haven't talked about the needs of the mum yet, but there'll be a reason. We'll come back round to that bit, because this is, I think, literally the order that mums tend to think of things. And we get to the sleep bits. And Louise, I was really interested to know when you start to see a connection between the physical body and maybe some sleep difficulties that babies or parents are finding.
Hi everybody, I'm Louise. So I have a few questions actually for you that I wanted to put to you, to both of you, because I do, like, as a sleep coach, I do see a lot of babies that come to me whose parents, for example, they're starting to go down the treatment for, say, a flat head. And a lot of times the first recourse for these parents are to go along to the doctor, and they'll be preferred to, and I can't remember the name of the specialist, that will literally put their children in a helmet. And they come to me to deal on sleep, but they'll say, look, we're not sure when to get started because they're going to go into a helmet. And my first response is like, whoa, okay, have you seen an osteo? So I'd love for you to explain to people what it is an osteo can do that maybe be able to help work with the baby so that so parents can avoid using a cranial helmet to try and rectify things such as a flat head?
Yeah, so that's a very common question, very interesting and common question. I think, again, as osteopath, we're always trying to understand what's the root of the problem. So a flat head can be caused by many different reasons. Back to the traumatic birth and creation of tension in the neck, for example, a baby would tend to turn their head to the same side. If they do that for a certain amount of time, they would tend to put more pressure on one side of the head and then flattening it. That's one option, one possibility. In that case, we're not going to target directly the head, but we're going to try to put the neck on the right track. So the idea is to make the baby as mobile to both sides and turning both ways to be able to let the body rebalance itself. So to the parents that are considering helmet, it really depends on what's the time frame, what's the timeline, and when do they consider that. Usually my patients that are at 2-month, 3-month-old baby thinking of a helmet, depending on the gravity of it, I would encourage them to try something else first, which is basically osteopathic treatment. Because until 6-month-old, 5 to 6-month-old, a baby has a very, very soft skull. So if you follow the milestone, everything can be done or can be fixed in a way until 6-month-old. So not that I'm against helmet, but I think it's a very oppressing and intense option, especially for some babies, especially in Singapore, because it's very hot and it's not necessarily super aesthetic. So again, depending on the gravity of it, parents need to consult the pediatrician, and then if it's for aesthetic reason, I think we shouldn't rush into a helmet necessarily. So that's one of the reasons why babies can have flat heads. So the reason that I gave was tension in the neck, for example. But if a baby develops a flat head for any other reason, we can approach the issue differently. But I would think that the most common reasons that I see are the link between the neck preference, the neck rotation preference, leading to a flattening of the head. That's the most common reason. So to that reason, the answer is usually work on the neck, work on the shoulder, work on everything that would allow the neck and the head to move freely for the body to get back on track itself.
Okay, then that's great. And because a lot of my clients will come to me going down the helmet path, and their biggest concern is how will it affect sleep? And I'm always the first one to say, please try osteopathy first, because if you can avoid, I'm not saying that it will fix it every time, and obviously age plays a part, but if you can go down that path without it, it just makes for better comfort for the baby. And I think it also makes the parents feel a little bit calmer and a little bit more at ease when they are putting their baby down to bed. I guess the other thing that I always like to talk to parents about, that you might be able to talk to parents about today, is about what musculoskeletal types of stresses do you think can impact a baby's sleep? And for that matter, even a mother's, I guess we're talking about parents a little bit later, but how do you think stress on the skeletal and muscular system can impact a baby's sleep?
Well, so the main one, basic main areas, I would say, when it comes to the nervous system and the stress-related ability to sleep or not sleep, the rest and digest system. So as Ikra mentioned before, the parasympathetic system, if there is an issue with it, baby is not going to be able to rest freely. And the number one goal for us would be to calm them down. If this is due to a musculoskeletal reason, which can be, again, the use of ventouse at birth, the use of tools like vacuum, ventouse, or forceps, the nervous system could be affected, and this vagus nerve that Ikra was mentioning before could be a bit compressed. If it's the case, it would have an effect on the whole parasympathetic system. So the idea is to release that vagus nerve that comes out from the skull through the neck. So working on the neck to give you a straight answer.
Mhm.
That's one option. The second option is working on, and if that's one of the reasons why, working on the digestive system directly. So the musculoskeletal system is obviously covering the body. So if there is tension in the abdominal area affecting the gut, baby is obviously going to struggle and the stress level will be high. So to address that issue, we would work directly on the gut, the digestive system, and try to release the whole area around the diaphragm muscle again, the mid-back, and as low as the hip sometimes. So those two main areas are very linked to the high stress level and ability to sleep, which are the neck and the tummy, I would say. So those are the two main ones.
Yep. And just finally, when I had both of my children, I had my son in the UK and I had my daughter here in Singapore. I was told that said you should take them to the osteo because you'll find that it will help them. And I very blindly, even as a new mum, trottled my son to an osteo on the other side of London. And equally, I brought my daughter to the osteopathic centre. And what I loved about Osteo Day was not only that I got to get out and about and see people, but I just could always guarantee good sleep on an Osteo Day. Like if my children, like they weren't great sleepers, I'll be honest, but until I actually sleep trained them. But on Osteo Day, I just knew that it was like, oh, Louise is going to get some sleep tonight. So what do you think is the reason why?
This parasympathetic system that was actually re-triggered. So if you think about the anatomy of the nervous system and how we get through it, we work on the head, and that's what people mention when they talk about the cranial work. So working on the cranial area is a way to unlock this rest and digest system. So it's very straightforward and simple. If you work on the area that is at the base of your skull, which is there, and if you do it yourself, guys, you're going to feel a bit of relief just working on those muscles. And usually that works magic with kids, teenagers, and babies as well. So releasing this area helps releasing the stress, help sleeping better. That's the way I would put it, right?
Yeah, definitely. I know my nephew had colic in the UK, and you just couldn't put him down. Like it was bad. I remember my sister waking me up and like, just hold him. Like she just could not take it anymore. So I said, look, I was in my second year of uni and I was like, why don't we go and see my lecturer who's a pediatric osteopath? So we went and she was like, yeah, I think it's colic as well. We're going to try this. And I think let's aim for 4 to 6 sessions, but let's see how we are after 3. I've never seen him sleep so peacefully in my life. He was like out, like lights out. The show's over. He was like knocked out. And not only that, the best thing that I think Greg does as well is teach my sister how to do those techniques. So my sister religiously, every nappy change, post baby bath, all that kind of stuff. And after 3 sessions, perfect. So yeah, it was like the deepest sleep ever.
Oh, wow. You do realize now you might have a queue out the door just for that.
We make people sleep better.
If it's okay with everyone, I want to stay on this track that you mentioned in terms of the rest and digest, because we've got Annabelle on here and I'm really fascinated, and because we've brought up the dreaded word as well and digestion. So Annabelle, what are your thoughts in terms of how osteopathy helps your clients out?
I guess feeding really starts with milk in the really early days. And I know that's such a big stressor. I guess when babies are young, all they do is sleep or eat. So when one of those aren't going well, it's really stressful for parents. Maybe you can tell us a bit more about how osteopathy can help babies feed better if that's an issue.
So when you say feed better, do you mean mechanically speaking or do you mean like content speaking?
I guess we can look at it from both sides. First, with the colic and reflux, things not staying down. Also, I guess later on we can touch about the feeding side of things as well, like the breastfeeding side of things as well.
Okay, so when it comes to the colic, so I think it's important to explain a bit what colic is. It's a big umbrella term to describe the fact that baby is being fed and slept, but still crying and looks uncomfortable. So because of the immaturity of the digestive system at this age, everything can be all over the place. And for some reason, baby would get irritated when something gets into the tummy. So I like to use this comparison, which is us adults being at the end of a cycle of a food poisoning. So we get this very discomfort. We're not dying anymore because we're at the end of the cycle, but we get this discomfort every time the digestive system is going through a cycle. And I compare that to baby's colic because sometimes they would feel good, they would look okay, and at some point they wouldn't. Usually at night, they usually get irritated by the fact that we put something in their belly and the digestive system is not mature yet. So how to work on that from an osteopathic point of view? And we're not talking about the content or whatever the mom is eating, or because it's more your field, but from a very musculoskeletal point of view, the colic is going to cause the tummy, is going to cause tightening of the tummy and tightening of all the areas around the stomach, basically. So working on those areas, as in releasing and relaxing those tissues, would usually make a difference and will help. When it comes to reflux, I don't want to go too technical here, but when you think about the tubes that go through to the stomach, they go all through this diaphragm muscle we mentioned before. If the diaphragm muscle is tight, it compresses the tubes and can cause some type of reflux. So again, how do we tackle that problem? We release the diaphragm to create space for the tubes to be less compressed and the food not to come back up or anything not to come back up. So working on the diaphragm, working on the tummy directly on the abdominal area would be the two main things I would do when it comes to feeding issue, as in after feeding, baby feels uncomfortable. And when it comes to the mechanical view on latching, and if we focus a bit more on the mouth, the TMJ, the whole cranial area, due to a possible inability to latch or some dysfunction when it comes to latching, this is another type of problem. And usually we're trying to understand why the latching is not happening how it should happen. So to give you an example, a tight jaw would cause baby to clench and to latch less smoothly than if it was less tight. So working directly on the jaw to release the tension and to allow baby to open their mouth more practically, I would say. So that would be one of the latching issue, but it can be coupled with a bunch of symptoms like a tongue tie, for example. So if baby has a tongue tie, to explain to everyone what a tongue tie is, and I think you guys all know, but the string between the tongue and the bottom of the mouth can be a bit too short, which wouldn't allow the tongue to come out or to move around as freely as it should. That would affect the latch, the direct latch on the breast or on the bottle, and would cause some restriction in the latching and the income of food. And that can indirectly have an effect on the stomach, on the tummy, sorry, and on the possible reflux.
And I guess looking at the mums as well, what about blocked ducts? Is there anything that osteopathy can do for that?
I would let that to you.
Yes, there is. As long as it's obviously not mastitis, and there's no infection or redness or anything like this, it is very effective to use ultrasound. Ultrasound therapy, which we have in each clinic, is fantastic. You usually have the blocked duct unblocked within the session, or if not, very shortly after. it is like a godsend for a lot of pregnant patients. And we also help teach how to unblock with massage, but very much it is ultrasound.
Yeah.
It is super, super, super effective.
I
So I would
actually have a
recommend
question
it.
about it. Yeah, do you do a lot of manual
No, not really.
release?
No,
Okay.
because the ultrasound is so effective.
Mhm.
It is, I would try with that first, and if it doesn't unblock, then I would either send to someone, but or teach mom how to do it. Yeah, so ultrasound all the way.
And I've got one more question. It's a big word, visceral osteopathy. Do you think you could run us through that?
You want to start?
You
Okay.
yeah.
Well, visceral means organ, abdominal area, and everything that is in that area. So we always talk about mobility when it comes to joints. When it comes to organ, and people really don't tend not to think about it, but there is also a lot happening in that area, and everything needs to be moving freely. We call that motility. So basically, it's the mobility of the organs. If some structures in the tummy, in the abdominal area, are tightening, that would have an effect on the organ's motility. So with a bunch of visceral technique that we use, which is basically going through the abdominal tissues and trying to restore this mobility, we make everything move very subtly. Again, it can be pokey, but it's not painful. Trying to reset, reorganize this freedom of movement between the tissues, the fascias, and the organs all together. So if, for example, you got a bit of a tension in one of the hip flexors that is going through the organ area, like intestine, the hip flexors muscle are probably going to friction onto the intestine. If you release those muscles, the intestine would be less irritated because less frictioning of the muscles around. So that's visceral osteopathy, right?
Yeah, and it's a lot to do with fascial connections between organs, but it's pretty much the motility of the organs within themselves. So kind of like constipation, diarrhea, all this kind of stuff is a lot for the gut, but for other organs as well, because organs also refer pain. You know, gallbladder can refer to your right shoulder, the tip of your right shoulder. You know, kidneys can refer to the kind of the flanks area. So what we're trying to do is make sure their movement within each other is smooth and easier.
Yeah, I think that's what visceral osteopathy is, but people think about visceral osteopathy as a very intimidating type of osteopathy, but it's basically working on the same way as we work on the rest of the body, but in the gut area.
That sounds like something that could be really powerful in your world, Annabelle.
Definitely, yeah.
I do really, really want to move and stress the next section. I want to introduce Dr. Sylvia because so far we've started talking about the mums and we've then talked about the babies and what we can do to help them. But I really would like to come back to what we can do for the mums because they forget about themselves and often it's us, other people on the outside, that have to remind them to remember themselves. So, Dr. Sylvia, from your perspective, what do you see in terms of the connection between the physical and the emotional?
There's a lot that I'd like to say about this, but first of all, I'm a big fan of osteopathy, which is one of the reasons why I wanted to be here in this panel. So, osteopathy in pregnancy, after birth trauma for mother and baby, postpartum as well, and even after pregnancy loss. So I don't think you necessarily need to rush into a psychologist and to be straight into processing trauma with very difficult techniques. I think that working with the body with an osteopath, for example, can feel like the first step towards recovery, towards well-being. And I have used it with my own struggles. And often it will be the first thing I go to. Either I see my osteo or I go for an amazing therapeutic massage. Because there's such a strong relationship between stress, anxiety, depression, and what happens in the body when it comes to, for example, muscle tension and levels of pain they have this kind of chicken and egg relationship where by working on the body and helping the body feel more at ease. I mean, you've spoken so much about the parasympathetic system. That's one way to heal. We don't just have to talk about our problems. We can take our bodies to osteopaths and other professionals that work directly with the body to start recovering from stress, anxiety. And I guess you're talking a lot about you as instruments and the techniques that you use, but you as human beings and as people might be the first clinicians that a vulnerable mother sees. So I feel so at ease just being on this panel and listening to you. I guess I'd like to hear about you as professionals welcoming women into your space, how you look after them, how you make them feel heard, because you play a counselor role as well. And I'm sure, as you know, you'll be asking them, how was your delivery? And you're going to get some good stories and you're going to get some pretty upsetting stories as well. And I guess to help women understand the role that you play in relieving those symptoms in the body and how they can help with their emotional well-being and recovery, but also as people, how do you make women feel safe when they're at the most vulnerable with their babies?
So, as you said, like, yeah, we're playing a bit of the role of a counselor to a certain extent, but I think most importantly, and it can happen prenatally as well, it's not necessarily postnatal, during the pregnancy, future mother would come to us with a lot of unknown. And the first thing we do is explaining that everything that is happening in most of the cases is common, normal, and that we can help. So I think is the first thing. Important for them to hear that they can relate to other people, because everybody or most of the people are encountering the same type of problem. I had a patient yesterday. We talked about Instagram and how Instagram is not the real life, for example. So we always look online and see all those amazing pregnancies. Everyone is loving their life during pregnancy. Everyone is breastfeeding from day one, like if it was the most easiest thing to do. But this is the opposite of what's happening in real life. So I think it's a lot of discussion, talking, and before getting on with techniques, explaining that everything that is happening at the moment is absolutely common and normal.
You provide that education, right? You provide that education so they can be reassured a lot of the things they're experiencing, they're not alone.
Yeah.
Exactly, they're not alone. That's the main point. That's how I approach it.
Yeah, I would say education for sure, and just letting them talk. This is the first usual self-love, self-care that they get postnatally. It's 30 minutes to themselves, for themselves, by someone who is hoping to help alleviate stress or tension or relieve symptoms or just have a conversation. Sometimes it's just talking through pain can be so powerful. Just be like, well, I wake up every day and my fingers are so tired from holding babies for so long, or I'm really, really struggling with the night feed, or I'm really, really struggling because I have an in-law that's staying over and they're taking over and doing old school types of cultural techniques and I'm not into it, and da, 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 da. So just letting people talk, I would say, is a thing. Anytime that you're any therapist, manual therapist trying to heal or relieve pain is always a positive. And yeah, explaining to patients that every pregnancy, every postnatal journey is different. No one's is going to be the same. And even within your own pregnancies, if you've had multiple pregnancies, they're all going to be different. I have patients that say to me, I feel so much more tired in this pregnancy. I'm like, yeah, because it's your third. Or yes, because you've got 2 little kids at home, remember that. And you're still dealing with X, Y, Z. So I think it's just that reassurance of getting patients to feel like they're not alone. I do keep up to date a lot with postnatal and ask definitely how the process went. So if it was a C-section or vaginal birth, and what that whole experience was like, if they want to talk about it, and talk about how the aftercare was. How was your obs and gynae? How's your doula been? How is everything going? And if it's usually Helen, it's usually fantastic. But just to let people know that we are here, whether you come in or not. Like, we're here, even if you want links, even if you want email, like, go and see this person, or I think you should talk to this person, or I think maybe not osteo, maybe you need to see a postnatal physio. It might not be us what they need, but at least we're the guiding point for patients.
Yeah, I think it's important to, like, especially with postnatal women, it's important to provide support and not necessarily just us. So let them know that they can reach out to this person, or this person, that they would be able to be heard by a wide range of people if they need to. And I think that's important to let them know that they have options. That's also key. Yeah, option is very much key.
Well, there was something I was going to say in that process when Dr. Sylvia was asking, what do you do in that space, especially with postpartum women? Something that I acutely notice that you guys do, and it's very inherent in how you work, is you give autonomy back to the women physically. The whole process of giving birth in a hospital environment that is obstetrician led, a lot of the time you get very touched out. Informed consent is applied maybe a little more loosely than some of us would like. And the way that I notice that the Osteopathic Centre performs their work is the absolute opposite. You request that permission to even touch an arm, a leg. You really start that process of giving women that power back, that autonomy in their bodies, which I'm sure is something that Dr. Sylvia does end up talking to a lot of women about post birth in that kind of very hospitalized environment where that power has been taken away from them sometimes.
And I think that can be a really good step towards recovery in a context of trauma, when that's handled with sensitivity, seeking consent to help women. Some women, just to cope, they completely check out of their bodies, they dissociate. So this can be one way to feel safe again in the body. Again, they're parasympathetic. So they come out of that fight, flight, freeze and form, so they can feel more at ease with themselves. Because if I'm going to do hardcore trauma work with someone, I'd much rather they come in feeling a little bit safer so we can process the difficult experiences they've gone through. So yes, I'm a big fan, and I often refer women for osteo. And I think for me, that's my first do, my go-to when I'm stressed.
Wow, I think we got such an incredible panel together today. Thank you all so much. I'm just going to invite all of you, if you've got any last minute things that you wanted, that you've forgotten to ask or that you wanted to mention, is there anything else that Helen, go for it. Hang on.
So we've talked a lot about the women and babies, but what about the dads as well? Because I think it's so important for dads to check in with themselves. They can also get postnatal depression, as I'm sure that can be backed up by the rest of the panel that all see. And I think it's so important for them to start that self-care by coming to see you as well. And often they're so tense, especially if they've had a brand newborn that's their first and they're holding this baby in a really awkward position and stuff. So do you see lots of dads?
Yeah, yeah, we do. But as we said before, when there's a new birth in the family, parents tend to not take care of themselves, and same with the dads. And as if I may generalize, usually the guys are the ones that are struggling the most to take care of themselves and to come and see us, baby or no baby. I've got a lot of examples where the wife is making an appointment because her husband is complaining too much but wouldn't do anything about it. So it goes to the same thing with the baby. So as you said, the dads would be in an awkward position and get to experience some issues like they would experience if they were at the office all day and just slouching all day. So they know that they are in pain, but they don't even think about taking care of it, and they don't even realize sometimes that they've been repeating the same movement over and over again, putting baby in the pump, taking it out, bending, carrying. So trying to explain and tell the dads as well that it's very much useful option to get treatment when you just gave birth as a dad.
I have a question. So one of the things that we didn't cover, but I think is really important, is I think osteopathy has that potential to really help with bonding. mother and baby, father and baby. And sometimes women who have had very difficult, maybe they had prenatal depression or they're just feeling overwhelmed, they're struggling with baby, they're not connecting, they're just seeing baby as a colicky thing that doesn't sleep. And I think osteopathy can play a really important role. So what role do you think you play as osteopaths? What have you seen in the room when you're, for example, working with the baby and the parent is there?
Well, I think just that, like being in a room with both parents and a baby. So a baby that is crying, let's say, managing to calm down the baby and realizing both parents that, yeah, the baby can be calm. It doesn't have to be upset all the time. So this engages them and makes a huge difference on how they look at an upset baby. So just being all together, reassuring them and showing them with, as you mentioned before, like showing them techniques that would help. For example, just rocking the baby on a Swiss ball. That sounds like easy and simple, but that makes a huge difference. So having them doing it when I see both parents at the same time with the baby, I usually do the treatment, the work, and then pass the baby to the dad, for example, and let them try an easy technique that I've been doing and that they can do at home. And I think that's the best way to make it collective and make everyone work together. And it's very reassuring as well, because they realize that they can do and have an effect, a calming effect on the baby. So that answers a lot of question and uncertainty when it comes to how at home I can do what we did during the session. And I think that gives them a lot of confidence, both parents. Do you agree?
Yeah, for sure, for sure. But also going back to like the fathers, because sometimes what happens is parents will tag team. So one will hold baby while I'm treating father, and then the other will tag team. And then I'm looking at like, actually, if you just move your hand a little this way, you'll get less to the thumb. Or actually, if you know, so you're always spotting little things. Like when I'm treating someone and I can see them holding baby, you can always be like, actually, maybe you try. And they're like, oh yeah, I am leaning really forward when I'm doing this. So it's kind of you're getting someone observing you whilst you're with babies. Also can be quite powerful as well. But yeah, you're right. Fathers don't come in as much. And it's funny because I have one father who comes in no matter what. but in general, fathers come in less. And I think it's a bit of a, oh, you know, she's gone through everything, kind of a machoism thing, where it shouldn't be like that. It should be they're equal party and taking care of baby as well. So treatment for everyone really is super important.
But I really see a lot of parents together coming into clinic with the baby, if they can make it because of work. But it's over the years, the last 7 years in Singapore, I see more parents coming as a couple with the baby when it's for the baby, more than before. So we're on the right track, guys. Less machoism.
Well, I think we have covered so much today. And again, I think we managed to put together the most incredible panel to really dive that little bit deeper into why we know you guys can be helping our pre and postnatal clients. So firstly, I am going to thank the panel. So Louise, thank you so much for your insights. Helen, thank you so much. Dr. Sylvia, thank you, because people on the call might not realize, but Dr. Sylvia has tuned in from Lisbon. So she has a rather large vat of coffee, probably keeping her going at the moment. So thank you. And Maud, thank you so much. And Annabelle, thank you again. I know Annabelle is a mother of a young child, and I think just a second ago she was called to her other duties, which is very common in our world. And Ikra and Gregory, thank you so much. Thank you for suggesting that we do this. Thank you for your time. Thank you for allowing us to help showcase what you do and introducing how we all work together in the village, because I think that's the last message we want to leave is the Pregnant and Pop community and network, this is what we're about. We're about connecting the mums with the people that can make the real difference to their journeys, the transitions that they're going through from pregnancy to postpartum to running around after a toddler. And together, we want to make sure that we connect those dots for people. So thank you once again, and hope everyone at home has a fabulous day. Thank you, everyone.
Thank you. We're so
Thank
grateful.
you, everyone. Yeah. Thank
Take
you.
the time out of your day, and see you at the next Pregnancy and Pop.
See you soon, guys.
Yes.
Thank you.
Thank you so much.